Is mold making you sick? Could it be the cause of your mystery autoimmune disease? Well, it was for me, and some experts estimate that 20% of the population could be struggling with mold toxicity and not even realize it. I recently figured out that mold was the cause of my chronic illness that I've been struggling with for the past 4 years, and I'm currently on an extensive treatment plan to get better. If you're new here, I have a degree in science, and I enjoy doing research on topics and reporting them.
Planet Near Podcast. This is the journey of setting yourself free.
CIRS, chronic inflammation response syndrome. So mold is a type of fungus that can make toxins called mycotoxins. For a normal person, once the toxins enter the body, the immune system recognizes them and creates the antibodies to take the toxins out of the system. However, 25% of the population have a gene that means that their body can't create the antibodies, and so the toxins get stuck in the system and circle around and around until you take medication to manually bind to the toxins and take them out of your body. So someone with that gene, instead of creating antibodies, the body produces cytokines, which set off a profound inflammatory response. So this condition is called CIRS, chronic inflammation response syndrome. And this is why if you take a person with mold illness out of the mold environment, they still remain sick. It's because the mold is stuck in their body and their body can't create the antibodies to take it out. So this is why many people with mold illness often have autoimmune diseases or chronic fatigue syndrome. The body is stuck in a perpetual inflammatory response that eventually becomes dysregulated. So when I talk about getting diagnosed with CIRS, I'm going to say diagnosed with inverted commas because you can't technically be diagnosed with CIRS in Australia. And this is because it's not widely recognised as a formal medical diagnosis yet by mainstream healthcare systems. However, specialist doctors will likely tell you that you have it and continue to treat you for it. So the best way to see if you have CIRS is to do the visual VCS test and then look at the clusters of symptoms. So as I mentioned previously, mold can cause multiple symptoms in multiple systems of the body. So if you have symptoms from 8 of the 13 clusters, then there is a 95% chance that you have CIRS. If you have symptoms and fail the visual VCS test, there is a 98.5% chance that you have CIRS. The different clusters test to see if you have symptoms from multiple systems. So I'm going to go now through these clusters and list the symptoms. Cluster 1, fatigue. Cluster 2, weakness, decreased assimilation of new knowledge, aches, headaches, light sensitivity. Cluster 3, memory impairment, decreased word finding. Cluster 4, difficulty concentrating. Cluster 5, joint pain, AM stiffness, cramps. Cluster 6, unusual skin sensitivity, tingling. Cluster 7, shortness of breath, sinus congestion. Cluster 8, cough, excessive thirst, confusion. Cluster 9, appetite swings, difficulty regulating body temperature, increased urination frequency. Cluster 10, red eyes, blurred vision, night sweat, mood swings, ice pick pain. Cluster 11, abdominal pain, diarrhea, numbness. Cluster 12, tearing of the eyes, disorientation, metallic taste. Cluster 13, static shocks and vertigo. So don't ask me what ice pick pain is. I have no idea what that is. But as you can see again, like a lot of my really weird specific symptoms fit perfectly into these categories. So if you don't have symptoms from at least 8 of these clusters, then you can still be sick from mold, but you just probably don't have CIRS. And that's something really important to know. Like even if you don't have the gene, you can still get really sick from mold. You just won't get as sick and it won't take you as long to recover. So 95% of people with CIRS do have the HLA-DR gene. However, there is a small chance that you can have CIRS even if you test negative to the gene. According to Dr. Kate Barry, she's noticed that 5% of the people who don't have the gene usually have a high level of MSH. So, if you like feel pretty in your heart that like mold is making you sick, it can be making you sick even if you test negative for the gene. That's the point I'm trying to make.